Looking at other jurisdictions that have had high vaccine rates, we can see that perhaps this pandemic's days are numbered.
It's a phrase we've eagerly been waiting to hear, but new data from Monday's public health presser shows that we could have gotten to this point in a more equitable way, and critics are calling for the next pandemic plan to do better.
In a post-pandemic Manitoba, our healthcare system won't be strained by a single agent.
At this point, hospitalizations and ICU capacity are still too high, and data from Dr. Marcia Anderson, medical lead for the Pandemic Response Coordination Team, shows that Black, Indigenous, and peoples of color attributed to those numbers at a disproportionate rate.
Based on population size alone, about twice as many hospitalizations than expected would have occurred in people from BIPOC communities, and the hospitalization rate is 3.5 times higher than it was for people who identified as white. In addition, the mean or average age of BIPOC folks admitted to the hospital was 14 years younger. The rate of ICU admissions was over 4 times higher for BIPOC peoples than it was for white people, and the average age was 10 years younger.
Dr. Anderson contributes this to housing and income status, occupational risks, and underlying chronic disease rates, which she calls the social determinants of health. She says Wave 4 and future pandemic responses must take this into account to make sure those more at risk are aided. The NDP saying this should have been part of the current pandemic response.
We have to work to eradicate systemic racism, not just from the social side of Manitoba, but from our economy as well. Because until we do that, we are not going to have as healthy and as prosperous a society as we could achieve.
The Premier and the Minister of Health should already have a plan in place to make sure that those most affected communities are going to be protected and adequately resourced moving forward.
Dr. Anderson says equitable vaccine access needs to be prioritized in the future, but gaps in health that are rooted in structural causes like employment or housing-related factors must be dealt with in the meantime.
Our fourth wave planning needs to prioritize public health interventions that address structural barriers to minimize this disproportionate impact of COVID-19 on BIPOC peoples.
In Winnipeg, Mike Albanese, City News.